Hello, and welcome to this series called I'm Pregnant, Now What? This is a series that I have created to help empower you to navigate the system. So, for those who don't know me, my name is Alicia. I am the podcast host of the podcast Couple with a Doula. I am an exercise physiologist, I am a doula, and I am a mom to two. The idea for this series came from doing my podcast and realizing that a lot of first-time moms actually had no idea about their options. They didn't know what they didn't know, and it was hard for them to get answers to questions they didn't know they had. So the aim with this series is to target mums to be and women who might be trying to conceive or thinking of conceiving soon, and try and piece together information about how to navigate the system. So this series is mostly aimed at women that will be birthing within a hospital, whether it's a private or a public hospital. But a lot of the information I do share can actually still be applied to another model of care like home birth or even free birthing. And so the aim of this series is essentially to help you to identify what birthing options are available to you. Learn how to question whether it's in your pregnancy or, for your general health, learning to question your healthcare providers, learning to say no if there are things that you don't want to do or it doesn't align with you. Learning that pregnancies, babies come in different sizes and shapes and things might look different, but it doesn't mean it's abnormal. Also, potential questions that you might want to ask your healthcare provider. So in this series, I'm trying to explore those topics and really give you the keys so that you have the knowledge and you can make decisions. You are in control, you have knowledge, you are in charge of your pregnancy, of your decisions, and you can make the most informed decisions because you know where you're going, you know what's coming, and you know what to ask. So if you know anyone who's pregnant, if you're trying to conceive, if you're pregnant right now, please share this with your mum friends, share this with your pregnancy buddies, share this with anyone you know who might be trying. Please share it so that I can help as many mums out there, as many mums to be, to have an empowered pregnancy, labor, and postpartum. Thank you so much for sharing the word out there. If you want to check out my podcast, I have put the links in the show notes. The name is Couple with a Doula. It's available on most podcast listening platform. It's available on this channel on YouTube, and you can actually watch the recordings with my guests instead of just having the audio. And please share the podcast as well. Every week I have a mom or a mom-to-be that comes and shares their story of pregnancy, birth, and parenting. And every month I have a health professional come on the podcast and chat about their area of expertise. So there is a lot happening on the podcast. There is already a lot of birth stories and professional interviews out there. So do check it out. Do share it. Spread the word. Do tell your friends about it. I'd really appreciate it. This podcast and this series is only able to exist because of you. So thank you so much for watching it, and I hope you enjoy it. Thank you. Hello, and welcome to this new series. So in this series, the aim of it is to help you to navigate the system after you find out you're pregnant. So whether this is your first pregnancy or it's not, but you're wanting to know what options are out there for your subsequent birth, this is going to be a great series to help you navigate the system. So the first thing that I want to talk about in here is what happens after you find out that you're pregnant. How exciting. So congratulations, you've got a positive pregnancy test. And now let's discuss what to do next. So usually for most people, the first point of call after finding out that they're pregnant is to book in an appointment with their GP or with the new GP if you haven't got one yet. And basically, this will help to get everything rolling. So, the point of getting an appointment with your GP is not necessarily to confirm your pregnancy, but some GPs might do a blood test to actually confirm it. It's more about getting referrals to the hospital, the birth center, or even the private midwife to help you get you onto that path of whatever model of care you are choosing to birth in. What I'm going to talk about now is actually the different options of models of care that you have in Australia. And the reason for that is a lot of women, when they first find out they're pregnant, they go to their GP and they expect their GP to basically guide them towards whatever model of care is the most appropriate for them. And some GPs are absolutely fantastic at this job and they can help guide women towards the best model of care. They can explain to them the different options and help them, decide and give them, pros and cons so that the woman can decide what is best for her. But unfortunately, a lot of GPs are just not that well informed or they just don't really know what's out there. As the name suggests, they're general practitioners, so they know about things generally, not necessarily in a lot of detail. So, therefore, I thought I would take you through the different models of care, and that way you can actually start doing your research now, even before you go to your GP. And then when you get to that appointment, you can actually tell them what it is that you want, and you can tell them what referral they need to write for you. So then you have decided already and you're not going in blind. In this episode, the different birthing options I'm going to discuss are going through the public system and seeing whatever midwife is on call, going through the public system and birthing within a midwifery group practice, also known as caseload midwife or team midwifery. I'm going to talk about GP shared care, as well as birthing in a public hospital with an obstetrician. Then I'm going to move on to birthing within a private hospital. So this time that will be probably with an obstetrician and maybe a team of midwives as well. And then I will talk about how to go about hiring a private midwife and also free birthing. So those are, to me, the 7 options you've got available to consider when you find out you're pregnant. So the first model of care, which is one that is the most widely available in Australia, is birthing through a public hospital. Now, when you do that, some places have a catchment area, so meaning you need to live within a certain radius of the hospital to be accepted and be able to birth in that hospital. And other hospitals don't have that. So it really depends where you live. So you might want to research, from where you live, how many hospitals or which hospitals are within a radius of, let's say, 20 to 30 minutes, and then just maybe research, type it into Google and see, whether when it comes to maternity, whether they have a catchment area or not. You can also call up the maternity of your nearest hospital and you can actually ask them whether you can self-refer yourself to their services or whether you need your GP to refer you, and also whether they have a catchment area or not. So you can be proactive in that. It doesn't cost you anything, and at least it's showing them that you're very proactive and involved in your care. I will take you through the midwifery group practice a little bit later, but first we're going to talk about the model of care where you are birthing in a public hospital and you do not have an assigned midwife. So basically you are seeing whatever midwife is on call, and hopefully for your birth you've met that person before, but it may not be the case. In terms of models of care, if you're going through a public hospital, the first model of care, if you have a low risk pregnancy, meaning you don't necessarily have any condition, you're pretty healthy, you do not have any medical history to take into consideration for this pregnancy, that's pretty much deemed low risk, and unless something arises in your pregnancy. So for that model of care, if you're birthing through the public system, what is going to happen from there is you've got 2 options. Either you go through whatever midwife is on call, and therefore there you will see whoever is on call at the time for your antenatal appointments. Maybe you might have some antenatal classes through the hospital, and then for your birth, you will get whoever is on call again. So hopefully you've met that person before. So coming back to you birthing in a public hospital, and let's take the approach of what the majority of women have access to, which is they just get whoever's on call at the moment to take them through their antenatal care. So the benefits of that is you do not have to pay. It's fully funded by Medicare. So usually your appointments would take place at your local hospital. It might be in the maternity itself, or it might be maybe they have a birthing clinic or something along those lines. And basically you would see your midwife in there. They would tell you when your appointments are, and they would be doing checks like, blood pressure, Doppler, feeling what position baby's in, helping answer any questions you've got. They can help to discuss what the birthing suite is like, what's inside the birthing suite, what your birthing preferences are, what your birth wishes are. They can answer all of that, right? But for the most part, as I was saying, if that's the only option available to you, that's great. But it can be a little bit not personal in that you're just seeing whoever's on call. So they may or may not have seen you before. Sometimes it can feel a little bit rushed because those midwives are under the pump. They're just booked out. They just have a lot of work, obviously. So in terms of birthing within the public system and seeing whoever's on call, so that's a model of care that's available through the hospital. And sometimes you can just see a midwife through your pregnancy, so you don't necessarily have to do GP shared care. It depends again on the hospital. Some hospitals, they will either require you to be within either the MGP or do GP shared care, but some have the option of MGP, GP shared care, or whatever midwife is on call. So in terms of GP shared care, you might have heard of that, and that's a widely used model of care. So what it entails is you basically see your GP throughout your pregnancy for your antenatal care. So your GP would be the person that would refer you for your scans. They would discuss with you the results of your scan. They would get referral for blood tests, urine tests, anything like that. They would discuss the results with you. And then as you move into your third trimester, that's usually when you'd move away from seeing your GP and you'd be put in touch with a midwife, and your appointments would then take place at the hospital with whatever midwife is on call at the time. This is a great model of care if you have a really good GP who is very knowledgeable, who knows about pregnancy and tests and what they mean. But as you move into your third trimester, it's highly likely that there's only a few weeks between you meeting the midwife or meeting a few midwives and then the actual birth. So again, it can be the case that you actually don't know who's going to be at your birth, and or you may not even have met that midwife before. So it can feel a little bit not personal again as you move into the third trimester and you're now attending the birthing clinic or the maternity for your appointments then. Again, the other advantage of this is all bulk billed by Medicare. Your GP appointment may or may not be. It depends on your GP clinic. So you would know whether your GP is a bulk billing GP or not. But when it comes to the antenatal appointment at the maternity and then those in the birth and so on, then it would be bulk billed by Medicare. So you wouldn't have any out-of-pocket costs usually. So then the second option for a low-risk pregnancy going through the public system is going through a midwifery group practice or a midwifery caseload, where basically you get assigned to one midwife or a small group of midwife, and therefore you get continuity of care. So usually you would get to know this one midwife. She would be the one taking you through your antenatal care, and then she'd be there at your birth. And usually you also get some postnatal visits. So whether that's at home or you go to their clinic, but you get continuity in your postnatal period as well. The problem with the MGP is that it is absolutely fantastic and they fill up so quickly. They're also not available at every public hospital in Australia. So you might have to do a bit of research there. Some MGPs, you can actually self-refer to them. So you can, as I said before, you can call up the hospital and actually find out if you can self-refer, because then you can do it really early on. You can do it from the time that you find out you're pregnant, or other midwifery group practices, you need to get a GP to refer you. So therefore, that's where that GP appointment comes in. I cannot stress enough, if you want to get into an MGP, do it early. Get your GP to send that letter, even if you have to remind them every so often, even if you have to chase up, the medical receptionist at your GP practice. Make sure that they have sent that referral early, because spots are super, super limited and you will not get in if it's not sent in a timely manner. As I was talking about, the next model of care, which is very, very, very difficult to get in, not widely accessible, is midwifery group practice, also known as caseload midwifery or team midwifery. And so in this model of care, you are being cared for by the hospital, so the public system, but you have been assigned to a single midwife or a small group of midwives. And the point of this is for you to build rapport with your one midwife or the few midwives in the team. So you're getting to know them, they're getting to know you, you're building this relationship there, so that when it comes to the birth, which is obviously a very intimate, very, very personal moment, then you know who's going to be in there. And this midwife knows you and she knows your preferences. She knows how you want to birth. And she knows about yourself, your health history. She's known all of that. So it's a great model of care. It fills up really quickly. So if you want to get in an MGP and or there is one available to you, please do call them before and ask if you can self-refer yourself. If you can, do that really early on. If you can't, then get into your GP as soon as you can and tell them that you want to be referred to the MGP at X hospital. And then they can write the letter, and please follow up with your GP, follow up with them or their medical receptionist, and just make sure that this letter has been sent and it has been received by the hospital, so that you know you're in their system, and then it's out of your hands whether you're picked or not. At least you will be able to know whether your referral letter has been sent, and then you will usually, with an MGP, they tell you between 12 and 14 weeks of pregnancy if you've been accepted. So from the time you send the referral to the time you hear back, there might be 6 to 8 weeks there. So that's completely normal. But, do know that if you don't get into an MGP, maybe have a backup plan. So decide what other model of care you may want to go through in case you don't get accepted. But otherwise, hopefully you get accepted, right? The MGP, they usually only accept low-risk pregnancies, so pregnancies where there is no complication, you don't have a complicated medical history, or you don't have any conditions that need to be taken into account, or you're only having a singleton pregnancy. But every hospital has their own criteria. And again, you can call the hospital and find out what those criteria are. So therefore, you can know from the get-go whether you have a chance or not at being accepted. The absolute benefit of MGP is that it is free. It's bulk billed by Medicare. You do not have any out-of-pocket cost. And you get postpartum care. So usually in the postpartum period after you've had baby, there are some visits that your midwife would do or another team of midwife would do, whether those visits are at home or they're at the birthing center or the maternity. It depends on the hospital again. But you've got a point of contact after you've had baby, which is everything. And it is so important to just have this continuity of care and not just have care that stops after you've had baby. The other model of care, but that's usually not for you to decide. If you're birthing through the public system, you can birth through the public system with an obstetrician. It's usually not in your hands to decide. This usually happens when something arises in your pregnancy where it's deemed a little bit more complicated. So whether that's gestational diabetes with blood sugar that is difficult to manage, whether it is that you've got a condition already that needs to be managed or taken into account during your pregnancy, whether it is that maybe you're not having a singleton pregnancy, maybe you're having multiples. So usually when you birth with an obstetrician through the public system, it's not in your hands, and it's usually because your pregnancy is deemed either medium to high risks for any reason. So whether you have an existing condition, or maybe you're having multiples, or there is something that's arisen in your pregnancy that means that you need a higher level of care. And so usually with an obstetrician, they will decide how often they will see you, that they will tell you what your pregnancy is likely to look like. Maybe you may need additional scans or whatever it is. So the other option, if you do want to birth with an obstetrician that you have chosen, that's possible if you go through the private system. So that's birthing in a private hospital with an obstetrician of your choice. And so usually that's an option for people that have private health insurance, or people that decide that they are happy to pay out of pocket and get the care that they have decided. So if you have private health insurance, do make sure that you have cover for pregnancy and maternity, because it may or may not be included in your current private health level of cover. Or if you've recently changed private health insurer, or you've recently signed up, there might be an exclusion period of maybe about 12 months for anything related to pregnancy and birth. So do make sure that you check whether those things are included, maybe even before you try, just so you know what level of cover you have through your private health, especially if this is a route that you are planning on and undertaking. So in terms of getting into a private hospital to see an obstetrician, usually the way you'd go about it is you'd be best to first call your private health insurance and just double check how the billing system will work, because you might be covered up to a certain level and then you might have some out-of-pocket fees. So it might be best for you to call up your insurer first, double check what their guidelines are on this, and then you can start looking into what hospital and what obstetrician you might want to birth at. So then regarding this model of care, so usually most people usually choose their obstetrician, and then the obstetrician is birthing at a specific hospital. So usually you'd pick the obstetrician, and then that would determine what hospital you'd be birthing at. But sometimes that obstetrician can birth at a few different hospitals, or you might know that in your town there is this private hospital, and then you're happy to pick whatever obstetrician is working there. The reason why some people might go with that is because with an obstetrician, you're obviously seeing the same obstetrician through your pregnancy. Some people might like to have that level of care because they know that if anything arises in their pregnancy, the obstetrician would be able to handle it. They might also get scans like ultrasounds at every one of their appointments as well. And you can also, obstetricians can work with midwives. So you might actually be able to also get to know the midwife there, so that when it comes to birthing, you've got hopefully a midwife in the birthing suite that you know and you've already met before, again, building that rapport thing. The other thing about birthing in a private hospital with an obstetrician, some people might like that because in the postpartum period, they can stay in the private hospital for maybe a week or so, and therefore get maybe some more assistance with just getting the handle on parenting, getting help with breastfeeding, and just getting to know how to become a parent. So that can be an option for you if that's what you'd like. Just know I will put it out there, and this is my personal opinion. An obstetrician by trade, by definition, is someone who is highly trained in taking care of high risk pregnancies or pregnancies that are not low risks by definition. And therefore, they may be more inclined to have interventions, so to intervene in the birth, whether that's through induction, the use of ventouse, the use of forceps, or episiotomies as well, and or any of those resulting in a cesarean. That's my personal opinion, and that may or may not be the case at all. The other option that's available in terms of birthing models of care in Australia is to hire a private practicing midwife. So a private practicing midwife is a midwife that has done, I think it's more than 1,000 hours of practicing as a midwife, and then has gone on to become endorsed to then become a private practicing midwife. So the idea of a private midwife is that they work for themselves. And so they have insurance, but they work for themselves. They're not working under a public or private hospital. And usually with a private midwife, you can birth in your own home, or you can birth. Some midwives have what we call admitting rights. So they can basically be your midwife, but you can still birth in a hospital. So in terms of admitting rights, what it means is that they have the rights to practice as a midwife in that hospital. You would have to check if you're wanting to go down the route of a private practicing midwife to birth in a hospital. You would have to check with this midwife whether they have admitting rights to a hospital or the hospital you're wanting to birth at, just because it's not always the case. A lot of private practicing midwife will help assist the birth in your own home. And the first step to getting a private practicing midwife is to go to your GP to get a referral, just so that you are getting some rebates through Medicare. So a private practicing midwife, there will be a fair bit of money out of pocket, but you do get a chunk of money back from Medicare. This has changed a lot, and I am actually not sure. I can't tell you exactly how much a private practicing midwife costs, because it depends on the state, it depends on the midwife, and so on. But you will get some money back through Medicare, hence the referral from your GP. You might find that some GPs may not want to refer you to a private midwife because they have their own opinion, and maybe they deem that having a home birth is not safe. If this is the case, do know that you have a right to get a referral to a practicing midwife. If your current GP is unwilling to do it, then change GPs. Find one that will write you a referral, because you have a right to get that referral and to get the care that you want. So just change GPs, find another one that will write you a letter, and there you go. The advantage of having a private midwife is that from the get-go, they will be your midwife. They will be the one that will be at your birth. Unless something obscure arises, usually they will be at your birth. So from the get-go, they will be the one taking care of your antenatal care. Whether you are 8 weeks pregnant and you reach out to them, or whether you change models of care maybe in your pregnancy and you're 26 weeks, they will then take on your antenatal care. They will be at your birth, and they will be with you usually for about 4 to 6 weeks after baby's been born. So there is a real continuity of care. They are really getting to know you. They're really getting to know your circumstances, your family, your partner, your children. They're getting to know everyone. And usually your appointments will be at home, at your own home. And your midwife will come in, and it will be more of a relaxed chat than a medical, so to speak, appointment. So they will still be checking, Doppler and checking your blood pressure. They can also write your referrals for scans, for blood tests, for any other tests that you need. And they will be able to discuss the results of those. But in terms of the actual care you're getting, it's a bit more relaxed. And a private practicing midwife, they're usually really good option if you're wanting to have an intervention-free physiological birth. That's usually what they're really good for. Now, I will put it out there. Do reach out to a private practicing midwife very, very, very early on in your pregnancy. maybe even before you get pregnant. So it might sound really silly to start like inquiring to midwives before you're even pregnant, but it's actually really common. It's more common than you think. And the point is that you get to know which private midwives actually service your area, because some of them, based on where you live, there may or may not be a lot of practicing midwives that service this area. So obviously they would get booked out really quickly. And so the idea is that you get to know who's practicing in your area, and also you get to actually, I guess, interview them in a way and decide who is the midwife that you would click more with, that, you know, is more aligned with you, with your beliefs and so on. And so therefore, when you find out you're pregnant, you already know who you want. So therefore you can reach out to this person straight away, and then they will take you through everything involved with the cost, how to get the GP referral, and then what to do afterwards. So they will be the one taking you through all of that. They know exactly what to do. So yeah, as soon as you found one, so either as soon as you're pregnant, as soon as you realize that you want a private midwife for a home birth or to birth in a hospital, or as soon as you decide that you want to change model of care, maybe, do reach out to a private midwife early. Even if you are 26, 28, maybe 30 weeks pregnant and you want to change model of care, do reach out to midwives around you and just check, because sometimes by an insane amount of chance, you might be able to get in and have the home birth that you want. So yeah, so do check that. Do know there are costs involved, but the midwife would usually discuss that very early on with you. They don't expect the payment of the entirety of the cost straight up. They're usually more than happy to put a payment plan in place, which can go all the way until after baby's born, and just let you pay week by week or fortnight by fortnight or something like that, because they know that it is quite a big amount of money. The other way to find a private midwife, if you have no idea how to go about it, is you can go on to, there are a few Facebook groups, like there is Home Birth Facebook group. There might even be a home birth for your state, so home birth Queensland, home birth New South Wales, Victoria, so on. Or ask in your community, so in your local community page, do ask if anyone's aware of any practicing midwife in the area, or if anyone has had a home birth recently and who did they have, and so on, so that you can start to compile a list of who is servicing your area. And then the last model of care I wanted to chat about is a free birth. So the difference between a home birth and a free birth is that in a home birth, you have a medical professional present at your birth. So usually that's a midwife. And in a free birth, you have no medical professional present. So you can have a doula, you can have maybe an ex-midwife, like a midwife that is not endorsed anymore or not practicing as a midwife anymore, or you can just have a doula, or just have your partner, your cousin, your auntie, your mom, whoever it is that you feel comfortable having in your space. But it's usually people that don't have any medical training that are present at your birth. So the idea of a free birth is that it's either an option if you do not have the money for a private practicing midwife, maybe, and you do not want a hospital birth, for example. Or maybe it's that you are just wanting to have a physiological birth, you want to have it at home, and again, you may or may not want a medical professional involved. It is totally your choice. It is totally legal for you to do that. There is no issues with that. It is your decision. I know it's not widely spoken about, and it's, when you research on the internet, sometimes it's not even mentioned, but I thought I would put it out there because it is an option if that's something you want to do. In terms of how to go about it, you don't even need to have scans if you don't want to. Any scans, any blood tests, anything in your pregnancy and postpartum is entirely your choice. You do not have to have anything. You do not, even if your obstetrician, your midwife, your GP says, oh, let's do a 12-week scan, you can say no. You do not have to have any scans if that's not what you want to have. For the most part, GPs, midwives, obstetrician will recommend what is what is basically commonly done, but you don't have to follow that if you don't want to. It is entirely your choice. You can do whatever you want. So you can have what we called a wild pregnancy, where there is no scans, there's no ultrasounds done, and it is just you growing your baby and going with whatever signals your body are sending and just trusting the whole process. That's the thing, and that's fine if that's what you want to do. So in terms of a free birth, usually you would be birthing at home. There may be a doula present if you hire one, or it might just be your family, your friends, your cousin, your auntie, your mom, whoever you're comfortable having at your birth. You may or may not want a birth pool to birth in water or not. It's entirely your choice. And in terms of a free birth, a lot of people prepare the exact same way for a free birth as they would for a birth of any sorts. Some people also like to prepare for the what happens if scenario. So in terms of what to do if, for example, baby is born unresponsive, anything to do with emergencies that could arise in labor. So some people that decide to free birth also like to know about that. But again, it's entirely your choice what you feel comfortable doing, what in what way you prepare for your birth. That's entirely up to you. So if you have a doula, they're not a medical professional by any stretch, but the reason why you might want to have one is because they can help you to prepare for your birth, whether that's a physical prep, so they potentially give you a list of what you might need for that birth. They can help you with obviously getting prepared, so doing all that birthing education, postpartum education, breastfeeding education, and so on, just so you know that you've got the tools and the resources to be on your journey to parenthood. And also when it comes to the actual birth, they're just there to hold space for you. So they're there to just remind you that you're doing amazing. They're there to hold your hand if you need that, or they're there to just hold the space, remind you of your birth affirmations, help guide you, help remind you that you're doing amazing, help to suggest changes in position, changes in places. They're just there as an emotional and a physical support, and they can also be a great support for your partner, for example, so to help also guide your partner to be your support person. Or they can be a great choice if you have kids as well, so they can be there for the kids if that's what you want. If maybe you think, I'm not really sure how my toddler, 5-year-old, 6-year-old would react to the birth, so therefore you have a doula as a support person for your kids to, entertain them, keep them busy basically. And they're also a point of contact if you have any questions of any sorts, right? Because, well, we do have questions in pregnancy, right? In terms of cost, it varies from doulas to doulas. It varies on, where they're practicing, whether there is a lot of doulas in that area or not. Usually when you reach out to a doula, they will tell you how much they charge. And again, they understand that it's usually a fair amount of money, so they're happy to put payment plans in place. Do reach out early to a doula as well, because again, they do fill out quickly. Again, it depends on how many doulas are practicing in your areas. They don't take a lot of clients every month. So depending on when you're due, it may or may not be a busy month for them, so they may or may not have spots. And the last thing that a doula wants is to tell you that they'll be there at your birth, and then they're totally flat out that month and they've been called into a birth, or they've got a few births around the same time as you, and therefore they're highly likely to not be present at your birth. So yeah, do reach out early. Do make sure that, do interview them just like you would with a private midwife. Just check that, this person completely aligns with you, is, on the same vibe as you, it resonates, what they're saying resonates with you, and so on, because they will be in your birth space, and it is a very intimate space to be in. This is recorded post-editing because I realized after I finished editing this episode that when I mentioned all 7 models of care, one of the things I didn't talk about, which is relevant but is not necessarily a model of care, is hiring a student midwife. So the reason why I wanted to include that is because pretty much regardless of the model of care you're going through, maybe give or take home birth and free birth, having your student midwife is really beneficial. And the reason why I say that you may or may not be able to have a student midwife at your home birth or your free birth is mostly linked to student midwives being able to attend those based on their university's guidelines. So by all means, if you're having a home birth or a free birth and you want to look into a student midwife, then definitely do reach out to some and see if they can, based on what the university says. But if you're having a hospital birth, whether it's through GP shared care, you're going through caseload midwife, MGP, or you're going through whatever midwife is on call, or you're having maybe even a private hospital birth, if you're looking for continuity of care, either because you don't have it through your current model of care or because you just want more or from a different perspective, then consider having a student midwife. So what it entails is it's a student who is studying midwifery. So a midwifery degree usually goes for about 3 years. So you can have student midwives that are in their first year of studies, all the way to student midwives that are about to complete their bachelor degree. And basically, as a requirement from their uni, they usually need to follow a certain number of women through their pregnancy, the birth, if they're comfortable with that, and maybe some postnatal appointments as well. So essentially what you're doing is you're helping those student midwives to learn and to really put the theory that they're learning into practice. And with a student midwife, usually once you've found one and you've decided to get her for your pregnancy or to have her follow your pregnancy, then she will be following you. So you get that continuity of care through this person. And it doesn't cost you anything. There is absolutely no cost involved. Usually the way to find them is I will put in the show notes of this episode 2 links to 2 Facebook groups where you can either see what posts have been done about, what student midwife is available in which hospital and so on, or you can post. So you can make a post yourself and just say, basically state where you're birthing, when is your estimated due date or due month, and maybe a little bit about you, if you want. And then you can contact the people that respond and, either meet them in person or have a phone call. And just like you would interview a private midwife or a doula, just get a sense for who they are and whether you think that, they are a good fit for you. You click well with them. The role of a student midwife is essentially to get to know you, answer any questions you've got about, pregnancy, birth, postpartum, and really guide you in your pregnancy and in your birth and in your parenthood journey. So they really want to get to know you. They really want to provide you with this continuity of care, and the experience they get from following you and you letting them in is invaluable. They get so much out of it because they actually get to step out of studies to actually see what midwifery is like in the real world. So it is invaluable for them, and it is great for you because you get to have someone who is the constant. So someone who that at every appointment, if the student midwife is available, she can come to them. Usually what happens when you decide to have a student midwife follow you is you will tell them when your antenatal appointments are, and if the student midwife is available, he or she will come to those appointments with you. And basically through doing that, they're getting to know you. They're getting to know your preferences, the type of person you are. They're also helping to answer any questions, because we know that sometimes when you're going through the system, there's just not enough time allocated to you to really answer your questions and talk through things and talk through what it means, those results, that scan, what it shows. So a student midwife is a really good point of call for that, because they are happy to spend the time with you. They're usually not on a watch. They're usually more than happy to answer any question, take you through, anything, they can help you with preparing for birth, preparing for postpartum, preparing for breastfeeding, and so on. So they're really good. And then when you go into labor, you usually call them, or your partner would call them, so that they know to come to hospital. And then same thing with the postnatal visits or appointments. You'd call them, or you'd let them know when those appointments are, and they would go with you if you're comfortable. And that way you've really got this continuity of care where this person is following you from the time you hire them all the way until baby's a few weeks old, essentially. And as I said, they're just really, really good to have, especially if you're in a model of care where you don't know who's going to be there at your birth, or you don't know who's going to be at your appointments. At least you can have one familiar face there. So if you're looking for a student midwife, I will put in the show notes of this episode 2 Facebook groups. One is called the Student Midwife, and I cannot remember the name of the second one, so I will definitely put it in there. And as I said, you can either search in the group for, student midwives that have posted. But I know from talking to student midwives that some of them cannot advertise and say that they are looking for women, so they rely on women posting to then contact them, if that makes sense. So it might be best for you to put up a post. You can even do it anonymously if you don't want, other people to know. And then you can then reach out to student midwives who you think might be suitable. And as I said, there's no cost involved. It's just about you providing those students an opportunity to put their skills into practice. So I thought I would add that. And on this note, I will leave you to it. And thank you so much for listening. I really hope you got something out of this episode. I hope it is helping you to know where you're going and to know more about models of care and to know what's available to you. Please keep an eye on other episodes, because I am doing a whole series about you're pregnant. Now what? Just because I know that when you're pregnant and it's maybe your first baby, or you've been pregnant before, but you just don't know much about, the system and what's out there, it can be difficult to navigate the system. So I'm doing a whole series for free. It's on YouTube about, what to do, navigating the system, asking questions, standing up for yourself, and just, being in charge of your pregnancy. So keep an eye out for other episodes. There will be a few. And please share this with, your pregnant friends, with friends trying to conceive, with, new moms, with whoever. Please share it, because it really helps me to reach out more people, and it really helps other people to just know their option and to navigate the system. So thank you so, so much. Also, don't forget to check out my podcast, Cuppa with a Doula, where I share every week a new episode with a mom about their pregnancy, their birth, and their parenting journey. And every month I chat with an expert in the field of breastfeeding, pregnancy, birth, and postpartum. So far I've had a student midwife on the podcast, a women's health physiotherapist, I've had a clinical nutritionist, and very soon there will be more expert. I have a birth photographer coming up. I've got a women's health occupational therapist interview coming up. I've got Catherine Bell from the Birth Map coming up as well. So please keep an eye on the podcast as well. And I hope you enjoy both this series and the weekly episodes that come out on my podcast. Thank you so much for watching this video, and I hope you enjoyed it. And I will see you in another episode.